She is. Good evening, Jan Michelle.
Hey, everybody.
Good evening. How are you?
Good. How are you all doing?
Fantastic.
Well, doing pretty good.
Dr. Henderson, are you president of the Cincinnati Medical Association?
No.
Nope, that's Dr. Shomo.
Dr. Shomo, and this is Shomo.
Okay. All right.
Dr. Dixon is treasurer, and Dr. Lane is secretary.
Oh, okay. Well, we've got a stellar group here. So you all know, just, whenever you're, did everybody, you probably got the instructions.
I got the instructions.
You all know what to do. So feel free to jump in.
Jan Michelle, I'm going to go ahead and connect us to Facebook.
Okay.
And we're live.
All right, this is great. Well, welcome everyone to the COVID-19 communityresources.com town hall meeting, powered by the Center for Closing the Health Gap. Your moderators today will be superstar Tropikana from The Wiz, and I'm Vice Mayor Jan Michelle Lemon Kearney. We have a super important topic tonight: keeping your family safe. We have a panel of experts. They're going to talk about COVID, the flu, and RSV, and more. And some people are going, what is RSV? We're going to tell you all about it. And of course, you'll have a chance to get your questions answered. So first, let's thank our tech team, John Reichel and Durance Daniels, and remind you that we are taping this session so that we can repost it for those who can't be here at the moment. Now, if you're on Zoom or Facebook, feel free to go right ahead and start entering your questions, and we will get to them in just a second. Let me turn it over to Tropikana, who's going to introduce our panelists.
Dr. Clyde Henderson. How you doing, Dr. Henderson?
I'm doing just fine. How are you?
I'm doing well. Very happy to be speaking with you this evening.
Well, thank you.
Would you like to say a few words?
Sure. I'm Dr. Clyde Henderson. I'm a semi-retired orthopedic surgeon, a member of the Cincinnati Medical Association, a very proud graduate of Walnut Hills High School. Go Eagles.
There's some Asuma.
Yeah, how about that? Did my orthopedic training at the University of Cincinnati, and practiced in the community for over 30 years before retiring in 2018. I became very interested in COVID-19 when I saw the devastating effect it was having on the African-American community, wanting to at least have a voice as far as educating folks about what was going on, and have been writing articles about that, and have been in a collaboration with the Center for Closing the Health Gap. Thank you, Ms. Mahaffey Harris, and all of you all for allowing me in, and glad to participate in this town hall.
Thank you, Dr. Henderson. Up next, we have Dr. Dixon. Good evening, Dr. Dixon.
Good evening, Tropikana. How are you doing?
Doing wonderful. We're so happy to hear you. We're happy to see you and have you here with us. Could you share a few things about yourself as well?
Sure. I'm a general internist, which means I care for adult patients, provide care. I've been at the University of Cincinnati, UC Health for more than 25 years in practice. And I, of course, was interested in speaking to everybody about all the respiratory viral illnesses that we're seeing at this time, especially because a lot of this we're seeing a little, in some ways, earlier than usual, for instance, with the flu, and having a real impact on everyone. So more information we can get out there, the better.
Thank you. We're looking forward to hearing your expert opinion on the things that we'll be discussing today. And last but absolutely not least, one of my favorites, she's not my gynecologist, but she needs to be Dr. Anthereca. How are you doing today?
I'm doing great, Tropikana. It's so nice to see everyone tonight. So I am an OBGYN here in the city of Cincinnati. I've been in Cincinnati for about 7 years now. And I'm proud to say that I'm now a TriHealth physician as of July the 1st, 2022. So I've been really excited to join the TriHealth family. So I am your resident OBGYN tonight. Hope to help answer questions and provide any information that may be helpful to our community of Cincinnati and all over the world.
Thank you so much. Jan Michelle? You're on mute.
I can't believe that. There's always got to be somebody who forgets to unmute. I can't believe that was me. I'm so sorry. But Dr. Lane, I was saying on mute that I'm so shocked it's been 7 years, because I remember when you first arrived. And so it's like, wow, time flies.
It does.
Okay. So listen, let's jump into some questions. Again, everybody listening, feel free to enter your questions on Zoom or Facebook, and we will get them to our panelists. We have a few already. First, before we talk about COVID, and even before we talk about the flu, let's start with something that a lot of people are really confused about and might not even know about, and that's RSV. Can somebody explain what RSV stands for and what it means? And, I'm going to call on Dr. Dixon, because you had started talking about this topic.
Oh, okay.
Respiratory illnesses, viruses. So it's like,
Sure, definitely. I would talk about it. So RSV, it's an acronym for respiratory syncytial virus. And it's a respiratory virus that affects, lots of people get it, but it affects most strongly infants, children, and the elderly. And in those people, it can be really, serious, leading to hospitalizations and worse. Most people will get it who are, let's say, of age, and they'll be fine. But for infants, or, those especially less than a year, those who are over, really 65, 70, and those who have lung disease, heart disease, and lung disease, sometimes people think, well, lung disease, I don't know anyone has that. Lots of people have asthma out here, and that's a lung disease. And so RSV is one of those things that it's hit sort of strong this year across the country. And probably it's because before we were all kind of isolated and people were wearing masks and all of that. And so therefore we didn't have the opportunity for happens, but it happens, frankly, every fall. Usually, it's just that we've had fairly low levels for the last couple of years because of the precautions we were taking, and now it's hit very strongly.
Dr. Dixon,
you answered. Oh, I'm sorry, Trop. Let me just say this real fast, and then I'm going to throw it right over to you. But Dr. Dixon answered a question I was thinking, like, why are we talking about it now? You said it's always around.
It's always around, and from a medical viewpoint, it's like, oh yes, RSV, and this happens. And we see that, but, the children's hospitals across the country, including here, have been jam-packed. And, Children's Hospital here even sent out a notice really to all the pediatricians sort of in town, asking for them to maybe extend some hours, because they just didn't have the capacity to take all of the people who were coming into the emergency department, who are coming into the urgent cares, so it's a lot. And it tends to happen for infants because RSV tends to can get pneumonia from it, but it can get something called bronchiolitis, which means like the really small airways in the lungs can be affected by the RSV. And of course, in infants, they have really tiny airways. And so if they get clogged up, they just can't. And there's just nothing more, it's kind of, I will say, pathetic to see some poor baby really working to breathe and coughing.
Wow.
Yeah.
Dr. Dixon, is RSV contagious?
Yes, it is. It is contagious. It's a respiratory virus. So they're all contagious in one sense. Again, most people will have gotten it, but it's not one of those things where it's not, I don't know, chickenpox, you got it once and you never get it again. It's, it's one of these things that continuously change. It doesn't have a vaccine against it. So people can get it. So I think it's important, and I think Dr. Lano could speak to this as far as when women deliver and they have their newborns and everybody wants to see the baby, you have to be real precautions, especially in that first 2 months, but really with RSV, that first, 8 to 9 months, the first year, you want to keep people away who have respiratory virus. And it's not enough for people to say, well, it's just a cold I have. When if you're around infants, it's really important to not spread that to them.
I have a follow-up question on that. Over the holidays, my little sister, who's not an infant at all, she contracted RSV, and we was quarantining by herself for a little while because everyone says she's contagious, so stay over there at your houses. And I've noticed that a lot of my peers are out and about and they've been contracting this virus.
Yes.
It's outside of babies. How can we protect ourselves from getting RSV? If I'm a baby, I can stay in the house and I'm not going to be seen. But as an adult outside on my day-to-day, how do I protect myself from contracting this?
Right. Clyde, do you want to, Henderson,
Sure.
you want a little thing on that?
Sure, I would love to. As Dr. Dixon was saying, this virus has been around for a long time. In fact, it was isolated in 1955.
Wow.
So long time. And so we see it, there's a lot of it out there. And as was said before, it's just attacking us earlier in the season. As far as prevention is concerned, it boils down to, masking. And, when you know that it's running rampant throughout the community, we probably need to be wearing more masks. It can survive on surfaces for a very long time. So hand washing is also very important. And, we go out, we're shaking hands and, not doing so much kissing and hugging, but you need to wash your hands and use hand sanitizer. And this is what we were doing for COVID early on, before we knew that it wasn't, hand washing wasn't having a major impact on COVID, but it does have a major impact on the RSV. So it's good to wash your hands and to mask and just stay away from people. And if someone is sick, they should be at home.
Wow. And then, so what I'm still trying
and
to
masking,
understand-
I'm sorry.
Yeah, at home and masking, but how dangerous is it? I mean, is this just, is it like a minor inconvenience or is it deadly?
It could be very dangerous for small children and infants, and also for the elderly and people who are immunosuppressed, immunocompromised. In fact, there are about 14,000 deaths a year from RSV, so it can be deadly. But the small kids are really can be really a bad problem. So it's important to recognize it and to get them to the doctor if they're becoming ill.
And is there a vaccine for RSV?
No.
Oh,
They're working on, there are trials that are going on, but there's nothing that's been approved as of yet.
Wow.
And it's been around for a long time, but normally it's not a big problem. I mean, and most kids have had it, as Dr. Dixon was saying, most kids have had it. And we've, and been exposed to it, and it's not a big deal. It's a cold, and they get over it and go on about their business. But they can be contagious for a couple of days before they actually diagnosed, and for up to 5 days afterwards. So if they're diagnosed, they need to be staying away from folks, and people who are taking care of them should be masked and doing a lot of hand washing and that sort of thing.
Now, Dr. Henderson, can I contract RSV in conjunction with COVID at the same time?
Yes, you can. You can get. We haven't gotten to the flu yet either, but you can get flu and COVID as well. There's it's called Flurona, if you want to. I mean, there's even a name for it.
Oh, you're kidding. Oh, my
No, I'm not
goodness.
kidding. But it's not, it's not that common, but it can occur. But you can have more than one ailment at the same time. Absolutely.
Blue Rona. Now that sounds horrible.
Sounds like something I don't know at all.
Yeah. Well, you
It's
know,
not
since-
common though, it's very uncommon.
Okay, well, since we're bringing up COVID and the flu, let's talk about COVID. Okay, so we went into the pandemic in March 2020. Here we are in December 2022. Are we done? I mean, are we out of this pandemic?
I don't think we are, for sure. I think it's easy to get a little relaxed at this point and say, oh, I don't need to wear my mask and I don't need to worry about washing my hands as much. I mean, everything that has been said already applies to COVID-19 as well, but I think it's definitely something that we still need to be concerned about and continue to mitigate those risks, especially in high-risk populations, and pregnancy is considered a high-risk population as well.
So what about vaccinations? Does anyone know how we're doing in terms of, herd immunity, getting vaccinated? We have 2 boosters, I think, that we all should have had by now. Is that right?
Well, I mean, if we come down to it, depending on the people, you could have as many as total, like kind of 5 shots if you're, potentially kind of higher risk. The latest booster is kind of the bivalent, meaning it kind of works against the Omicron, which I think most people have kind of heard of now, the Omicron variant, because the original vaccines were pretty good for the original and for some of the changes, but Omicron's a whole sort of a little different change. And so because of that, the latest booster, but honestly, people are tired of boosters. Even people who got their first 2 shots and maybe a booster are kind of tired, like, really, I get another shot.
Right.
But COVID is still out here. I checked kind of some of our data.
Oh, good. Data's good.
It's still, like, I think I have down, like, it's still in the area. There's like 34 people in the ICU right now.
34. Yeah.
Yeah. And
Vaccinated people.
And I'm going to tell you that I don't know. That one is just like kind of some of the data that's shared between the hospitals.
If you are not vaccinated, you are. What are you doing?
Yeah.
Most of it. I'm sorry. Go ahead.
Oh, I was going to say the one thing that's a little bit, how do I put it? The numbers don't tell the whole story. We can tell who's hospitalized, but to a certain extent, the sheer number of people who have COVID now, we just don't really know, because people are doing home tests, and if they're positive, they just hopefully stay at home.
Stay home, yeah.
And talk. So, there's still, I still get a few people a week who test positive for COVID, they're still out there. And, in wintertime, respiratory viruses tend to be higher, mainly because we're all inside with each other. Go ahead, Clyde, I'm sorry.
And if you look at the CDC data, they're telling us that all of the counties in our area, they have been on a low level of involvement for probably the last couple of months, few months, in fact. But now, all the counties in Ohio that abut Hamilton County, including Hamilton County, all the Kentucky counties in the greater Cincinnati area, they're all medium now, which is a higher level of COVID spread, if you will. Only Dearborn County in Indiana is still low. So it, like Dr. Dixon was saying, it definitely is still out there. And there have been about 1 million diagnosed cases in the last month. And,
Wow.
A lot of them are undiagnosed because people, as was stated, we're doing the testing at home. So it is still out there. So we still need to be taking precautions. And yes, people are tired, but nevertheless, people are getting sick and going into the ICU. We should still be getting vaccinated. And for the most part, folks who are vaccinated don't end up in the ICU, although I can't tell you exactly the status of those people who are in ICUs in Cincinnati right now. But what the national authorities tell us is that if you get vaccinated, you're protected from going into the ICU and from dying from COVID.
Wow.
And, and Dr. Lane, do you recommend that your pregnant patients get vaccinated?
I
know you-
do.
Okay.
Yeah, I definitely encourage them to get vaccinated. We're finding that when pregnant women get vaccinated, the severity of the illness is much less. And so definitely would encourage that. And something else I would like to encourage the audience to just be aware of is that if you're pregnant and you're beginning to have some worrisome symptoms, emergent symptoms like chest pain, shortness of breath, don't avoid places like the emergency room, because that's where you need to be. I know some people will avoid going to the doctor, going to the emergency room when they really need to be there because they're concerned about contracting RSV or the flu or COVID-19. And I really encourage you to make sure that you go to the ER when you're pregnant and you have those worrisome symptoms, the headache that doesn't go away, the chest pain, the shortness of breath. You put on your mask and you get to the ER as quick as possible.
Wow.
And I was going to ask you guys, do you still recommend that people wear masks all the time?
Yeah, I know it's not very popular.
It's
and I know
not.
that because I'm the one person walking around my grocery store with a mask on.
With the mask on.
With a mask on, and who's going, so I know it's not very popular, and I understand that people are tired, but I think especially, I still think that it's warranted in, especially in these settings. And I think the other part of that, I had hoped, I think when all this came out, first thing, that we would find at least that people who had respiratory symptoms would at least think about wearing a mask also. And maybe that would be an accepted thing for people to start doing. Like, oh, I've got some sniffles. I don't know quite what I have yet, but maybe I would wear a mask. And I think that's one of the important things also.
Okay, Dr. Henderson and Dr. Lane, what about you? Are you guys wearing masks?
I am. If I'm outdoors, I don't wear a mask. But when I go inside, then I'll be wearing a mask. If I'm traveling, even at the airport, I will wear a mask. When I'm on the plane, I don't wear a mask because once the doors are closed, the filters in those planes are really very good at filtering out the viruses. So we're relatively safe. And if someone next to me is coughing, I'll put my mask back on.
Right.
But when indoors, I will wear the mask. And there are particularly now, if you look at what's happening in our area, we should be masked more because the COVID levels are starting to increase. And I'm sure we'll get into it with the flu that's out there now. That's the way we can protect ourselves, So the answer is yes.
Okay, Dr.
Indoor.
Lane, how about, yeah.
Yeah, I definitely still wear my mask indoors, primarily in places where it's a crowded situation. So like, for example, if I'm going to walk through the airport and I know that it's a lot of people around me and we're all packed in there, I'm definitely going to have my mask. But if I walk outside, then of course I take that moment to take a breather. So that's kind of how I use it. But yeah, I still definitely, I carry a mask with me all the time. I have it, I wear it. And I ditto on what everyone has said that yeah, I think there's still value to wearing the mask for sure.
Okay, Tropikana, how about you?
I am still wearing my mask every chance that I get, especially when I hear somebody coughing, and I'm putting my mask on Boogie often.
Oh, you know.
especially this winter, and after that RSV in the family, yeah, we're all wearing masks in the house.
Okay. All right.
mean,
So wait, so here's a question from Dr. Lou Edgy, who usually is on the panel. So I'm
Yes.
so glad she weighed in. It's like, where's Dr. Edgy? So she said, and I don't know how to pronounce this. So doctors, you're going to have to correct me. But she said, any thoughts about Lily's bebtelovimab being pulled from the market a couple of days ago? Maybe that's from the market.
Yeah.
Okay.
Okay.
So any
Yeah, I had to
thoughts?
look at
Some
that.
medicine by Lilly being pulled from the market a couple of days ago. And Dr. Edgy, thank you. She said she wouldn't miss this broadcast. Thank you. Okay, how do you say that? Bebtelovimab?
Well, those are bebtelovimab.
Bebtelovimab. Okay.
Yeah, I'll go with that.
And I still
And-
don't know what that is, Dr. Dixon.
Right.
What is that?
There are a lot of, so there are a number of kind of antiviral medications and immunoglobulins also that have been in use. And I have to admit, I haven't kept up to that extent. Some of them aren't effective, for instance, against Omicron. Some of them were effective against the original COVID and alpha, beta, we went through all of those.
Right.
But some of them aren't as effective. And we end up not something sort of kind of go away because they're not effective anymore. They're to do it. Things have changed. And that's all. I have to admit, I didn't know more than that, but I know some things we just aren't, for instance, don't use anymore because of that.
So I guess these medicines, it sounds like, and maybe this is just an obvious thing, but they're being tested on an ongoing basis. And
This is, some of the medications and all this is, some of this is still under the emergency use, experimental use in some cases. Yeah. I know people hear experimental and I'm already can hear my voice being used in some kind of, conspiracy commercial, but in this case, you have to, because of usually these medications and infusions, that type of thing are only, are used in really higher risk people who have whether it's related to age or pregnancy or, lung disease or immunosuppression, these things tend to be used in that.
Wow.
Well, that's actually kind of, reassuring that, they're being monitored in an ongoing way. And then Dr. Edgy added, okay, and you guys are going to have to explain this, but she said not effective against BQ1.
And BQ 1.1.
Yeah, and BQ 1.1, that's right. She said, I'm glad the FDA is keeping up with what is effective on these variants. What's BQ1 and what's BQ 1.1?
Yeah, so these are still, with COVID, variants are coming.
We're still getting new variants?
We're still getting new variants. And some
variants
COVID
needs to quit. This is ridiculous.
Some of these things are in different areas of the world, and we tend to see variants, around that happen in a specific country. Sometimes it crosses borders. Sometimes it just sort of kind of snuffs out, I guess is how we put it. So those are, the ones that have come up the most, the BQ1 and BQ 1.1 are the ones that we're seeing sort of the most now. But to a certain extent, viruses change. And so that's even with RSV and even the flu, which I think we're going to talk about. But the flu vaccine, the reason why there's a flu vaccine sort of every year in a lot of ways is because they, the variants changed, with the flu also. And so they have to create a new flu vaccine in some ways, a lot of, each year to catch up with the variant. So I know people think it's a lot different, but a lot of viruses do this.
Now, and you mentioned before, let me just point this out. So when you go for your COVID booster, I guess you want to make sure, and you mentioned this, that it's bivalent, which means it goes against the Omicron strain. Is that right?
What I will say is that pretty much that's what the pharmacies are carrying now. So that if you get it now, that's what they have. So you don't necessarily even have to say, hey, I want that new, this is what you're going to be getting now.
Okay. All right. That's good.
The authorization for using the others as boosters has been taken away. So they're not supposed to be using them at all for boosters. And let me just say one other thing. This gets back to the point that Tropikana was asking about vaccination. As long as we have people who are not getting vaccinated and these viruses continue to proliferate, they continue to be out there and spread, then they're going to change. And you'll get all these variants with all these letters and names and so forth, that will be foreign to us, but we'll get to know them because they're going to be around a while.
Right.
Now, if I'm unvaccinated for COVID and I catch RSV, how dangerous are the two of those viruses together, and how is that treated?
Anyone? I was going to say the thing with RSV is you're looking to sort of support people. It's respiratory virus, it's, yes, you can get any combination of those together, even though most people will get it perhaps just once, one of them, but, sort of affects, it can affect in different ways. RSV, a lot of times, again, it can cause a pneumonia. It can kind of sometimes go down in the lung. COVID can also. So sometimes it's just in the upper respiratory part, and sometimes it'll go on. So would I want to have both? No. I guess it's the way to think about
Or
it.
either.
Yeah. Wouldn't want to have both. But I would say even at the beginning of the pandemic in March 2020, April 2020, whenever we start testing, we were in a kind of a high flu level at that point, and we saw people with the flu and COVID. And of course, there was no vaccine or anything there. And people did, those people did be quite poorly, and were, a lot of times hospitalized.
Wow.
Okay. And
Yeah.
Trop, you were talking about some things like should we expect for COVID numbers to rise each winter? We had
Right.
started talking about how we're up to Dr. Henderson, you said the medium level, and I'm thinking we're at the low level, but you said no, we're at medium. Is that because it's just winter time? And so is that like going to be a yearly thing? We just expect it?
It's suspected there probably will be. We're still technically in a pandemic, but we're probably going to be moving to a different phase at some point, which means we'll be in an endemic, which means that it will be coming back and over and over again. And we'll probably have to get other vaccinations just like we do for the flu and as things stand right now. So it's going to probably be around with us for a while. But hopefully not at the levels that we've had it before. And obviously right now we're not losing as many people from COVID as we were a year ago. But still it has an effect on our lives.
So basically people need to just be prepared to get a COVID vaccine, just like their flu vaccine every year.
Probably that's going to be the case. That's what we're being told.
Okay.
All
right. Okay. Let's talk about the flu. I mean, the flu just, didn't seem like a big deal, but I hear that it is, that, there are like many deaths. I don't know if anyone has numbers, but, a horrible amount of deaths each year from the flu. Something we don't really think of as being such a big deal, but it is. Can anybody address that? Does anyone know?
I'm sorry, go ahead, Dr. Lane.
Oh, before we got too far away from COVID-19, I just wanted to mention that there was a study out of Johns Hopkins just a few days ago that talked about Paxlovid, and Paxlovid is a medication that we're using as outpatient treatment for COVID-19. And the study basically talked about how they did a study looking at about 47 pregnant women, and they found that it was actually safe to use in pregnancy. And there's been very limited information about whether or not it was really safe or not. And so I think that moves us definitely in the right direction to make pregnant patients feel comfortable to use a medicine that if they actually get COVID-19, they have mild symptoms and they want to keep them mild and not get into a more severe phase, that Paxlovid is turning out to be a very viable option for them.
Oh, wow. Well, that's encouraging.
From Facebook, Jan Michelle, that says the World Health Organization estimates 290,000 to 650,000 people die of flu-related causes every year worldwide. So what virus between COVID and the flu are more fatal?
Wow, because I think our numbers are down from COVID.
Yeah.
Right. But I was going to say, go ahead.
No, go on.
What I was going to say, COVID is what we call a novel. It's a new virus. I mean, there's a lot of different coronaviruses that have been out, but this is a new virus. So since none of us basically had antibodies, it's one of those things that, we have over 1 million people who have died in the US from COVID. So the fatality rate was higher with COVID than is with the flu, even though the flu can be serious. And people every year, probably in the US each year, you're talking about maybe, and this is just totally from maybe memory, maybe depending on the year, it could be anywhere from like sort of 35 to 50,000 a year might die from the flu each year, which is still 50,000 people who are not here. But, at the height, we were seeing, again, over a 2.5 year period or whatever, we've seen over 1 million people die. So
you're talking about from COVID, not the
from
flu.
COVID.
From COVID.
So
okay.
yeah, worldwide, obviously the numbers are even higher for both, the flu worldwide and, for COVID that we have seen.
So, so Kevin from Facebook, thank you for sharing that information from the World Health Organization. So my question to our panelists, given that now we have antibodies for COVID, a lot of, like I've had COVID, a lot of people have had
Yeah.
COVID, if not, we've been vaccinated. Are our numbers going to be less? And why is the flu still so high in terms of fatalities?
I would suspect that we will probably not enter a phase where we're losing 1 million people in 2 years in the United States from COVID, because people have been exposed and there's some immunity from that, and people have been vaccinated, which is actually better immunity from that. So that and we know from the information that's available that the people who are really getting sick are the ones who have not been vaccinated, and so. There are going to still be some deaths and some hospitalizations from COVID, but I doubt that we'll reach the levels that we have had over the last 2 years.
We have a question from Facebook from Teresa. She said, about how long will the third booster be effective? Anybody on the
We laugh because it's like, had that might have $1 million in my pocket if I knew that. Basically, it sort of depends. I mean, we can at least say that more than likely it's at least 4 months is what I'll say. Could be longer. When you, even with vaccines, you can still get the disease. Not to say that you can't, but your chances of becoming hospitalized or significant illness or having long COVID, which is another problem that can happen, is greatly diminished. So
talk about long COVID, Dr. Dixon, please, because I keep hearing about long COVID. What is that?
Yeah, long COVID is sort of I'll call it a constellation of symptoms that tend to last longer than what we would consider sort of the 30 days. And so some of that can be, it can be that some people have a chronic cough that can go on for months. Some people can have problems with their breathing for a long time afterwards, or I've got someone who is just getting their sense of smell back, and it's been about 1.5 years, and she had a really mild case of COVID, but it affected her smell, and it's just recently then that started to happen. But the other thing that I think distresses a lot of people is sort of sometimes what we call the brain fog, where they just don't feel quite as, I will say, sharp, they feel just a little, not as sharp, or they have a lot of fatigue, and that, sometimes, we've seen cases of that lasting, 6 months or more.
Is there anything that you can do to counteract that if you do have these long-term symptoms? Because you still got to go to work. You still got to take care of your business. And now you have this brain fog and you can't smell and you're tired when you go to work, and that doesn't stop. So what can we be doing to assist our body or assist our mind when we have these brain fog moments from long-term COVID?
Anybody else?
I think you have to kind of wait for it to resolve and of course take precautions that allow you to not get into trouble because of that. If you can't smell, you can't taste, and it's going to take some time for it to get better. There's no magic for it. You have to take care of your other general health to prevent you from getting other ailments, and so that you keep up your immune system so that you're not getting sick. But you can't do anything to speed the recovery from that. That's one of the problems with it. That's what makes it different from these other viruses, And I know that we're talking about the flu and the fact that it may be killing more people, but you don't have those long-term effects from the flu unless you get pneumonia. Of course, it can kill you as well, but still you don't have the brain fog and the loss of taste and smell from the flu.
And then someone, Thomas S. is asking us, can long COVID become permanent and turn into a chronic disease?
Right. What I would say is, it's hard to know because we've only had COVID for so long. So do I know if those symptoms are, that people have, even if they've had them up to a year, do I know if they're going to be permanent? I don't know, is what I would say. So far, have I had people who've had it, and people who've had COVID more than once, then they, even have, had some problems and then had COVID again. And, there's that problem. So, you can say that maybe there might be a percentage of people who are permanent, but right now, I don't know. I would say we don't have enough information just from a length of time type of thing to know, oh, this is permanent.
I hope not. That would just be horrible. Oh my goodness.
I just imagine or really wonder how many people have lost their jobs because they weren't on point after contracting COVID and they were just undiagnosed with these symptoms. We have a question from Facebook from Victoria. She said, can this panel speak to vitamin supplements that we should take to help boost our immune systems, such as vitamin D, C, and zinc, and the benefits of staying hydrated? She said something else, but I can't pronounce it.
I love this question. I'm always looking. I really believe in zinc. I always tell people take zinc and vitamin D. But okay, doctors, you guys with the real medical degrees, what do you think?
I think that a good balanced diet and taking the vitamin supplements are certainly not harmful. I'm a believer in zinc as well, although there are no studies. Now, when we look for data, you're talking about data.
Yeah.
There's not, at least that I know of, there's not data that will tell us that it's going to make a difference. But I know that we do tell people to take your vitamins, take zinc and vitamin D and C, and to make sure you keep your immune system in tip-top shape.
I just remember. Yeah, I was going to say. Now I remember when President Trump got COVID, and that from what I heard in the news, the first thing they did was give him zinc and vitamin D. And so I'm like, okay, that's what they do for the president. So that sounds like.
I think that's the public statement they put out.
Right,
but
exactly.
I don't mean it like that, but he was getting, antibody infusion. I mean, he was getting some real, before it was available to the public,
Yeah.
So the zinc and the vitamin D sound good, you know what I mean? In the sense of, oh yeah, he's getting that. He was getting some really heavy duty stuff at a certain point. Yeah, I don't think any of those, I was taking vitamin D. I need to take vitamin D anyway, but I was taking some vitamin D, especially during the height of it. I don't know. Yeah, the data is not necessarily there. I'm a big fan of, making sure that you're, kind of have a balanced diet. Junk in, taking some vitamins is not going to do it, I guess is the thing, Staying hydrated is important, I think, for just a variety of, health reasons. So.
Jan Michelle, I'm with you on that zinc and vitamin C and vitamin D. My mother just moved to Japan last week, and the last thing she did was drop off a mother load of zinc, vitamin D, and some vitamin C for me and my son.
A woman after my own heart, I tell you.
Take this while I'm gone.
Yeah. And you do what mama says. Make sure you do what mama says.
That's right. I'm a cancer survivor
diet, like y'all said.
Yeah, I'm a cancer survivor too, and they say that vitamin D helps to fight cancer. So I'm just a vitamin D person, and zinc. Okay, here's another question from Teresa on Facebook, and let me just mention: don't take advice from people who aren't doctors. Make sure you listen to doctors, right? Except your mom. Except your mom. Okay.
Right.
Like, I can't give you medical advice, so let me put that disclaimer out there. Okay, that's why you guys are on here. Okay, here's a question from Teresa on Facebook about how long will the third booster be effective?
I think we tried to answer that. Basically, it's one of those things. I can say that, it's going to be effective at least probably for 4 months. It could be longer, but that's what I would sort of say safely. it may, as again, it may be longer, may last longer because we have the same, all of these, you get a boost. And even though there's things that we can measure, there's some other kind of immune things going on with the body that we don't necessarily measure. And so, those things are also impacted by having the vaccine. And so that's, one of the positive things there. I've encouraged people now to get it because there's still a lot of COVID sort of circulating around. And, you're trying to, I'm sorry, looking at the next one.
All right.
And, looking at the, kind of the next, thing. But, so I encourage that.
We have a question from Kevin on Facebook. Kevin said, why do vaccinated people represent most COVID-19 deaths right now? With a red exclamation mark and a red question mark. The share of COVID-19 deaths among those who are vaccinated has risen.
Is that right, though?
Kevin, I'd like for you to share your source with that, if you don't mind as well.
Yeah,
Do
I
you
have to
have
question. I have to question what and Kevin, no offense, I'm just wondering because it seems to me that people who are vaccinated are the ones not dying and not being hospitalized in general and not being as sick. But doctors, what do you think?
And I don't know that for sure is what I will say. What I will say is that unfortunately we've had, lots of people in some ways die before we ever got the vaccine. And then you get the people who are vaccinated. The vaccines do wane is what I will say, is one thing. And more people have the vaccine now. So just from a sheer number of people who have the vaccine that, percentage wise, that may, that could happen is what I'm going to say.
Okay, Kevin is sharing some more information. In fall of
Okay, so Kevin ought to be on the panel. Kevin, you're gonna have to call us.
Yeah.
Because Kevin
Kevin
has a lot of
said-
research. I don't know if this is Kevin Farmer or not, but whoever this Kevin is, you've got a lot of research.
That's
Okay,
fine.
I'm
We
sorry,
want people to look at things.
We do.
Right.
Kevin said in the fall of 2021, about 3 in 10 adults dying of COVID-19 were vaccinated or boosted. But by January of 2022, as we showed in our analyst posted on the Peterson KFF Health Track Center, about 4 in 10 deaths were vaccinated or boosted. I'm going to speak to that myself. By April 2020, the United States Center of Disease and Control and Prevention data showed that 6 in 10 adults dying of COVID-19 were vaccinated or boosted. And that remained true through at least August of 2022. Well, that answered your question, Kevin. That's not the majority of people that are vaccinated. 3 in 10 is not the majority.
Right.
And we did not have vaccinations in 2020, at least not early in 2020.
Yeah, this
That
is
was not until December.
Fall
But then,
we hadn't really gotten the vaccine, just sort of, was one of the things that just sort of started. But you go ahead.
Right.
Go ahead, Clyde.
no, I'm just not familiar with all of the data. I can't, I would like to, I like to read it. I'm always looking for additional information, so I can't dispute it without seeing it.
Right.
Thank you for sharing that,
What I
Kevin.
will say is the sheer number of people, fortunately, related to the vaccine and related to just so many people have either had it or not. Just the sheer number of people, the death rate is not as high. Let's, face it, from where we had COVID in March, April, December of 2020, when there were large numbers of people who were, to now, where the virus itself has sort of changed a little bit. And this is one of the things, the virus is, we say wants to live. And so one of the things that happens is that the virus wants to live so that they kind of adapt so that they can keep living. And if the host dies, then that doesn't help them all the time. So they have to keep spreading around. But again, more people have been vaccinated. So just sheer number wise, if the majority of people, I say again, I don't know the actual numbers there, but if the majority of people are vaccinated, which they generally are, then just from a sheer percentage wise, you may have more people vaccinated. I don't know. I don't know about boosted because I've got a lot of people who are vaccinated, but their last vaccine was over a year and a half ago, you know?
Mhm.
And so that's not exactly the same as someone who has been vaccinated and boosted, boosted, than someone who had it, you know, who had the vaccine over a year ago. So that's what I would say. But, good question, Kevin. We can always look up more, look at some of the data and look at some of the information on that.
Yeah, we do know we do know that as people are getting vaccinated, the number of deaths and hospitalizations are going down. So
And-
that's really good. Let me ask you all, because we've been talking about, so there's no RSV vaccination, but there's a flu vaccine and there's a COVID vaccine and then the boosters. Is there any population that should not get any of those vaccinations, like a certain group? And, I'm thinking like, just, I'll throw out an example, maybe somebody with, diabetes. And I'm just saying that, I'm just asking, is there any certain group of people that you feel, be careful getting the vaccine for the flu or COVID?
I think one simple kind of response would be if they have an allergy to any aspect of the vaccine. So if they have an allergy to eggs, for example, that might be something that may move them away from a certain vaccine. Or if they've received the vaccine in the past and they had an anaphylactic reaction to it and they were in the hospital and couldn't breathe, and then that would be something for sure.
Okay, and then
And just recall that none of the COVID vaccines were from eggs or have any egg products in them. And there are non-egg, there are influenza vaccines which don't use egg either, although the majority of them do. But still, I think the recommendation is that if you have a minor allergy to eggs, then you can still get the vaccine. If you have a severe allergy, then you should get a different vaccine for influenza. But COVID, there's no, but if you're allergic to any components of the COVID vaccine, of course, you should not get that vaccine. You should try a different one.
So number one, check with your doctor, right? To
Yes,
see
always.
Yeah.
Yes, this is general information, not
Right, exactly.
specific.
Right, exactly. Yeah. That's a
Okay,
major
now
caveat. You should always check with your doctor.
Yeah. Okay. So there's a follow-up question from Teresa Miller, and she says, so if the variant changes again, the boosted people who've been boosted are not protected?
Not necessarily, because it depends on how much variation happens, basically. So the original vaccines, for instance, were pretty effective all the way through the last, through a number of different variants, through all, I think again, when he was a Lambda and Mu, and went through all of these, bringing back sorority days or something for me, going through the Greek alphabet, right? So, they're, doing all of this. So the vaccines were still effective for that. It's just that the latest was a bigger change. And so that's why we had to make the change. But we don't know that we won't have just kind of small little changes that this particular booster can still be effective against.
Okay.
And as Dr. Dixon has said earlier, you get two different types of immunity from vaccinations, and one of the immunities may be helpful as far as preventing you from getting a severe case, even if the virus has mutated. So there's still some benefit to having been vaccinated, even if a mutation occurs. It doesn't mean that the vaccine is totally ineffective, but it might be less effective against a new variant.
Good to know. I mean, you know what? Knowledge is power. It's really important that people, and that's why I really appreciate the Health Gap doing this and you panelists for coming on, because knowledge is power and there are so many questions and people wonder. And this is why the Center for Closing the Health Gap started these town halls back, 50 town halls ago in 2020, because people are getting so much misinformation and afraid to really do the right thing and, take care of themselves because nobody knew what the right thing was. So thank you for that. every time you guys come on, I just learn so much.
I have a quick question before we close this, Jan Michelle. I still have a lot of hardhead, knucklehead listeners and friends who do not believe in vaccinations. And with the flu this year, I still have people who are saying, I don't need no flu vaccine, Tropikana. I'm going to just take some zinc and some vitamin D. With COVID numbers rising and
Right.
RSV, how important is it for people to go get that flu shot?
I'm sorry, what did you just say? How?
With
How
all of the things
important.
that we have, how going on right now, how important is it for our followers, listeners to go and get that flu shot?
I think
Anybody?
I think it's very important to still get that flu shot, especially, I mean, I've been focusing a lot tonight on pregnancy, but I think definitely in pregnancy, when we were talking about issues related to in basically trying to ensure that symptoms are mild versus a more severe case of either the flu or COVID-19, one of the best ways to do that is to get vaccinated, along with, you know, all the other ways that we can mitigate the process there. So definitely, I would say it's definitely still important, definitely would encourage it.
Thank
All
you,
right.
Dr. Lane.
Great.
Dr. Dixon, Dr. Henderson, do you guys have any comments in regards to that?
I would just echo what Dr. Lane was saying. I think it's extremely important to take the vaccinations that are available, which would include flu and COVID vaccinations, and keep up with those vaccinations. That's the best way to protect yourself. And then whatever other mitigating things that you can do from the standpoint of wearing a mask and washing your hands would be important as well. But getting the vaccination is going to be your best bet.
Thank you.
Yeah, I wanted to add that in pregnancy with the flu vaccine, if you're ever, if someone tries to give you the nasal spray for the flu vaccine in pregnancy, you should not take the nasal spray because that's in the category of a live vaccine. So in pregnancy, we typically do not recommend live vaccines. Live vaccines are generally given after you've delivered. So if you're offered the flu vaccine and they say, well, which one do you want? Don't take the nasal spray.
That's interesting. Is that true for asthma too? I don't know. I know when my son was little and they were vaccinating everybody at school, and most people just got the nasal, and he couldn't get the nasal because he has asthma.
Right. And so they do recommend, well, they recommend that you don't get the nasal vaccine because if you have asthma.
Because
Mainly
it's
any inhalation thing is thought that it might trigger the problem. Yeah, I have people over the years who won't take the flu shot, and I get it, the flu vaccine, but I think it's important. And sometimes I know it's been a harder thing society-wise, but some things aren't important just for you. They're important for, you know, the people who are around you. I mean, lots of my, you know, older patients got COVID from their children, their adult children, their grandchildren. And the same thing can happen for the flu. They may not go out much, but if people come out and they bring it in, you know, that's why I think it's important also for the person involved who has the problem, who has asthma, who is, you know, elderly. But it's important for the younger people to do it who have actually a pretty good response to the flu shot and the COVID vaccine, so they don't carry it in, you know, and, you know, and I think that part of it, I think is important. As much as I know everyone's tired about it. Everybody's got COVID fatigue, I understand.
We cannot.
Yeah, but you know what? We've got to
healthy.
stay vigilant though, right? And we've got to just, you know, just keep going, just like you take your vitamins, you know, you eat your food, hopefully exercise. I mean, it's just part of life now.
Yes.
Absolutely. Before we turn things over to Monet Mahaffey-Harris, our CEO of the Center for Closing the Health Gap, can we get any final comments from Dr. Dixon, Dr. Henderson, and Dr. Lane?
I would just start by saying that sometimes you have to do what you don't want to do so that you can do what you want to do. And we don't want to wear masks. I know we're tired of it, But I would encourage you to just continue, as you say, to stay vigilant. Think about yourself, your families, everyone that's around you, and hopefully we can get on the other side of this, or at least kind of be smooth sailing a little bit. And we also hope that this conversation encourages you to have a dialogue, an educated dialogue with your doctor. So we don't want you to take anything that we've said as face value. We want you to do your own research, but then also have that conversation with your healthcare provider.
Thank you, Dr. Lane. Dr. Henderson?
I really don't have anything else to add from that standpoint. I think she touched it all, but we have to save ourselves and get your vaccinations, wash your hands. And when you need to be away from people, please stay away from folks, socially distanced. And thank you for allowing me to participate.
Thank you, Dr. Henderson. And Dr. Dixon?
Oh, I also wanted to thank you for allowing me to participate in this and try to inform people. Like 2 people contacted me earlier. I said, oh, I heard you're going to be talking this evening. And I was like, really?
Oh,
Okay.
good.
So hopefully they were, able to get on and, were involved with as far as the information. Yeah, I think that one of the things I'm going to do a little bit aside is that sometimes I find that people who have chosen not to be vaccinated, for instance, against COVID, are also the people who also are fairly anti-mask also. And so I don't think that's a good combination. And so I would, just encourage people information-wise, do the things as far as keeping yourself healthy, which from my viewpoint include the vaccines, but also to try to protect people around you. And protecting people around you a lot of times involves wearing a mask.
Thank you, Dr. Dixon. With no further ado, let's turn it over to Ms. Renee Mahaffey-Harris.
Well, we have just a few seconds left. I just want to thank the doctors Henderson, Lane, and Dixon for joining us today. And I think your point is that we need to continue informing ourselves and having a conversation and asking the questions. I hope everyone has a blessed and safe holiday season, and take care of your families and take care of yourselves, because we must save us. Thank you all. Thank you, Trop, and thank you, Vice Mayor Kearney.
Thank you, everybody. Great
Great
conversation. Loved it.
I appreciate it.
Thank you.
Bye.
Bye-bye.
Bye-bye.